Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/childwelfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters, and for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. On this week's podcast, Keri Richmond, Manager of Child Welfare Policy for the American Academy of Pediatrics, joins us for the first of two guest interviews this month that will focus on the new rules on federal funding for congregate care, that's group homes, residential treatment, institutions, shelters, etc., that took effect in 2021 thanks to the Family First Prevention Services Act. So Richmond led AAP's national survey on implementation of these rules, which included some focus groups with youth and with child welfare leaders, as well as leaders of congregate care facilities. Next week's guest, Jim Zarniak, did a very similar thing on the state level in New York, and those two efforts surfaced some pretty much identical and very concerning things. Richmond is also the executive director of Unbelievably Resilient, which produces a truly excellent podcast that has just begun to release its third season. So we're going to talk a little bit about that. And I would just say I highly recommend the first two episodes, which are already out. It's called Unbelievably Resilient. We talk on this podcast about Keri's experience obtaining her foster care files. There's a really great second episode of Unbelievably Resilient in this third season, where other co-hosts of the show talk about that same thing. So let's do some quick headlines first, and then we'll get to that interview with Keri Richmond. And the Imprint has covered all of these stories, so it just goes without saying, as usual, I'm going to drop links to the articles that we have published on everything I'm going to talk about here in the show notes if you want to read more. So we'll start in California, where there was some interesting court action and legislative activity around the same issue, and that is timelines to permanency and the path to reunification for youth who are in foster care. So in a case called Michael G. versus Orange County Superior Court, which kind of, I think, got the ball rolling on that case in 2019 with a teenager, Michael G., the state's high court ruled that dependency court judges should not automatically extend a court-ordered deadline even when social workers failed to connect parents to the services that could be used to help them reunify with kids. So instead, the opinion notes that juvenile court judges and bench officers should just make individual determinations about whether additional time is warranted to give to a parent, granting appeals only for the exceptional situations. So that ruling generally tracks with the federal expectations or requirements around pathways to permanency and timelines that were set out for the first time in the Adoption and Safe Families Act back in the late 90s, which basically said that if a youth is in foster care for 15 out of the past 22 months, the state should move towards terminating the rights of the parent and moving towards, another option other than reunification, or at the very least concurrently planning for that. But that law sets out some exceptions for states to use. Probably the most used exception to those timelines is when a child is living with relatives or fictive kin. But one of the other exceptions that's in the Adoption and Safe Families Act is essentially that if the child welfare agency has not done enough to amount to reasonable efforts at reunification, a judge can take that into consideration and grant, more time under the law towards the timeline to reunification. So at the same time that the Superior Court is basically just reinforcing, that's the federal rule here, and our view is that the state law does not mandate anything past that. There is a bill that is moving with, so far, pretty much unfettered support, right? Unanimous support, Assembly Bill 937, which would do exactly that. So, basically what would happen under this bill is if a judge were to find that the child welfare agency failed to deliver services, and facilitate family visits, basically if they just fell down on the job, when it came to reunifying or making attempts to help a parent reunify, then the judge automatically would give an extra 6 months to that parent where they would have no fear of having their rights terminated. So instead of there being, an exception basis, what this would do in California law would say, once the judge has determined that there were not reasonable efforts to reunify, that finding in and of itself adds another 6 months to the clock. It still leaves a lot in the hands of the judge. I mean, the judge always has had, both in California and everywhere, the ability to give that exception out and say, look, you guys haven't done anything or nearly anything to facilitate the reunification, so I'm not going to, move towards terminating this parent's rights. You got to work with them harder. This sort of still leaves the determination about that in the hands of the judge, but then imposes essentially an automatic circumstance or automatic kind of consequence if the judge actually does put that on paper or does make that finding that, no, you didn't make efforts to reunify. So it puts a lot on the judge's willingness essentially to say in official court record, that the child welfare agency has failed to make those reasonable efforts. Sticking in California for the second one, we have talked a couple times in this podcast about the strange collision course that a lot of things are on in Los Angeles as it pertains to youth justice. They are, supposed to be moving towards entirely reimagining their system with a lot lower use of incarceration and probation, a lot more community alternatives. At the same time, the state is closing all, basically by the end of June, all of their state level incarceration for juveniles. And so Los Angeles and every other county will be seeing any young people who are incarcerated, mostly for serious offenses, that are housed in state facilities coming back home. And then there is the 2 youth incarceration facilities that are in the county, which have for now more than a year basically been considered over and over by people who have come in to assess them basically as like unlivable, untenable places for youth to be. And the most recent person to make such a case was California Attorney General Rob Bonta, who recently laid out in a press release essentially the fact that the general conditions of these facilities are now kind of being meshed together with staffing shortages that are kind of affecting everybody in, the entire field of juvenile justice, and creating worsening conditions. I'm just going to read from the press release. The conditions with the juvenile detention centers in Los Angeles County are appalling, due in part to a staffing crisis plaguing the juvenile halls. The county has not just failed to make forward progress towards compliance with the judgment, it has actually regressed away from complying with the most basic and fundamental provisions that ensure youth and staff safety and well-being. He continued to reveal that illicit narcotic substances such as fentanyl have entered the halls of the Los Angeles facilities, requiring the use of Narcan on 2 youths. He also added that youth in several instances have been forced to urinate and defecate in their cells overnight, and that is due to the low staffing. So Bonta is initiating new legal action against Los Angeles County in regard to these facilities. There is a body in the state that could put these facilities out of commission and have incrementally moved, I guess, ever more towards that and just continuing to slam the conditions there. What they need to do is basically just make a ruling that, and I should say the name of that entity is the Board of State and Community Corrections. If they were to find, officially that these 2 facilities in Los Angeles were unsuitable, then that would require the county to close them down. And so thus far, despite all the mounting evidence that things are just horrific in there, they have not moved to just finally, call it unsuitable. And, this is me editorializing a bit, I guess, but I think what that speaks to more than anything is the fear of not having literally any space to put any youth that they feel are either a risk to themselves or a risk to the public. And that is kind of a hard sell, to be honest, when the conditions within those facilities are so terrible that you can't guarantee the safety of either the staff or the kids in them. But that is where they're at. And I think appropriately, one policy, associate or advocate who is at a recent board event or a county event about this, Avalon Edwards from Starting Over, put it this way, and I'm quoting from him: failing to find the unsuitability today is setting a clear precedent that the board will never hold any probation department in California accountable for child abuse, no matter how inhumane their juvenile hall conditions may be. And I would tend to agree that in a situation where a finding of unsuitability would create a situation where there was, for a county, particularly a county as large as Los Angeles, no available bed space within these incarceration facilities, that, the board is probably not going to go there, even though they know it's probably the right thing to do. A lot of editorializing by me there, but I'm just kind of trying to read in the middle of what the heck is going on there. Last one for this week is there kind of two related things out of Washington, D.C., the old Beltway. Group of legislators have introduced the Find and Protect Foster Youth Act. This is a relatively light attempt to put some pressure on the Department of Health and Human Services to kind of get an assessment of what's working and what's not on the state level in terms of tracking and finding youth who either run away or go missing entirely from the foster care system. So it kind of doesn't really come with a lot of money. There's not a lot of requirement really for any on states. This is essentially requiring the Secretary of Health and Human Services, but it would be, the Administration on Children and Families within that agency that would probably carry out this work, to evaluate state protocols and outcomes on finding youth who go missing or run away from foster care, and then also helping states with identifying the right kind of screening tools and services to offer to a youth who returns from about where they were running away or had gone missing and returned back. And I think one in particular they'll be working on is, the right offer of screening and services for youth who might have been sex trafficked. So this bill follows, maybe a couple of years here where some media reporting has surfaced just how many youth actually go missing from some states. Some states have a very bad record when it comes to the number of youth who are just running away from foster care, period. In a recent audit of, cases involving missing or runaway foster youth with the National Center for Missing and Exploited Children, finds that states are really not availing themselves or doing much work to notify, the national agency that essentially exists to help governments find kids when youth in foster care go missing. So what this audit found, and again, we wrote a little piece on this, so I'll link people to that. They can get to the audit if they really wanted to go geek out. But it was 74,000 cases that the auditors reviewed, and they estimate that in 47% of them, missing children were never reported to NMIC. That's the National Center for Missing and Exploited Children. And then an additional 22% of the cases, the reporting to NMIC came late. So add that up, you've got about 60, not almost 70% of kids who ran away or otherwise went missing while in foster care that were never reported to this federal agency. That I say federal agency, it's a nonprofit, but it's essentially kind of quasi-governmental in that it gets an enormous amount of money every year through the appropriations. I want to say in recent years, it's been around like $80 to $90 million every year, basically to just help, state and local law enforcement to find missing and exploited children. So in 7 out of 10 cases, either they didn't bother to report them to NMIC or they did it very late in the process. And then further, the audit found that even when those reports did come in, they often had a lot of inaccuracies or data quality issues. So, the media reporting on just how often it's happening, plus this new indicator through the audit that, states don't do the work to, go and try and get help from this agency that exists to help them, probably has something to do with prompting this legislation. All right, I lied. One more thing before we get to the interview for this week, and that is a correction that I have to make on something that I said in last week's episode. So I was discussing new approvals for the Prevention Services Clearinghouse. These are the services that can be used to help states prevent foster care removals in some child welfare cases, part of the Family First Act. I noted while we were talking about that 3 kinship navigator models had been approved, the most recent one being the one that is used in Nevada. I was corrected by a listener who politely chimed in and said, actually, that is the 4th. There was another one that was approved in the fall, and indeed, she was correct. The Arizona Kinship Support Services, which is managed by or overseen by the Arizona's Children Association, was approved back in September, and I completely missed it. I actually went back and looked, and I didn't even see them listed in any of the clearinghouse notifications that went out. So I don't know how I missed that, but Arizona Kinship Support Services, and actually, it is worth mentioning that the other 3 Kinship Navigator programs that have been approved, one is Colorado, Nevada, and then one in Ohio, all got the promising status, which is the lowest one for inclusion in this Prevention Services Clearinghouse. The Arizona one actually got supported, so it's the highest ranked Kinship Navigator, and I'm sorry that I missed it. Sorry for erasing them when I was listing it out, but now you know. The Arizona Kinship Support Services. All right, when we come back, my interview with Keri Richmond.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code podcast10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code podcast10 today.
We are joined today by Keri Richmond, who is so many things, but for the purposes of today's conversation, she's the manager of child welfare policy for the American Academy of Pediatrics, who just put out a 50-state review of congregate care reform in America, with a particular eye on the early impact of the Family First Prevention Services Act. Keri, long overdue to have you on here. Thanks for joining us on the Imprint Weekly podcast.
Thank you. Excited to be here.
Got to get these folks to know you a little bit. That's our rules here before we start with the serious talk. So you can give me one of these or more. I feel like you're going to have answers for more. You can give me your favorite TV show or movie, book, musical group, or sports team. Keri Richmond, what do you got?
Oh my goodness. I gotta say, I'm a bandwagon sports fan, so we probably shouldn't go that route.
Okay.
I actually just watched this weekend A Good Person. It's the new movie that was written by Zach Braff, and Florence Pugh is one of the main characters. I really think it's my new favorite movie. They just did such a masterful job of portraying addiction and how addiction does not discriminate, how you can be living a very great life, having a very great job, and still fall into addiction. And then the way that it really can wreck, your relationships with your family, your friends, romantic partners. And then just the portrayal of friendship and grief throughout it. I just thought it was masterful and was so impressed with Zach Braff. And yeah, great movie.
That's a hell of a review. Which of my 20 streaming things do I go to find that one?
You have to actually go and
I have to go to a movie theater?
Yes. But it's worth it, I swear. Best $13 I've spent all month.
13, that must have been a matinee. You're in DC, so that must have been an early day. Okay, so I think before we get into the report and what you found here, let's set up for people, what the Family First Act did as far as congregate care. I'll lay it out a little. You fill in because I'm sure I'll miss some stuff, but I'll link to our guide and AAP's excellent guide of the whole Family First Act, but for what we're talking about today, for your run-of-the-mill placement of a youth into a congregate care facility, which would be a group home, it could be an institution, it could be a residential care facility. a state can now draw down federal funds to pay for that for 2 weeks, which is a big change because it used to be just for as long as they wanted. But there's these four notable exceptions to where 4E money, the federal money, can continue past that 2 week mark. One is for pregnant and parenting youth. One is for a child that's 18 years or older, supervised independent living, youth who are at risk of becoming sex trafficking survivors or defined, there's lots of different wording around this, but at risk for sex trafficking. And then there is the qualified residential treatment program, which is this kind of class on paper of programs. We'll get to that. Programs that could serve youth with acute needs, some clinical requirements. You got to be accredited, supposed to provide an aftercare program, all of that. And while this all became law in 2018, those requirements for most states hit in October of 2021. Do you feel like I got it all? There's probably some few things I missed there.
Yeah, yeah. And I would just emphasize, like the idea here is that congregate care does not continue to be this catch-all for
Yeah.
young people who maybe can traditionally, this is not my quote, but other people's quote, hard to place, then it's this default to congregate care. And this is really looking at, okay, who are the kids who have an acute clinical need, who fall in those other specific buckets where we're really reducing the over-reliance on this. So I think you nailed it.
Okay, so let's begin with what you all did to try and get a sense of the 50 state lay of the land here. What was AAP's process, led by you here, for assessing the change in congregate care of late?
Yeah. Well, I think it's important to lay the groundwork and give some background here. So 2018, this is passed and signed into law. And then we have this implementation deadline in October 2021. And so it's like, hey, states, this is your chance to really get your act together and implement these congregate care reforms. You've had several years to lay your groundwork of, is it foster parent recruitment that you need to work on? Is it really building up your kinship care system so that that's ready to go so that then you can reduce the over reliance on congregate care. And I think as we were leading up to that October 2021 deadline, and then the months after, there was so much conversation in the community about how it was not possible to implement these congregate care reforms, or how there were all of these burdens and barriers and this and that. And we thought, what is the true story here? What's actually happening on the ground for states? What are actual burdens and barriers? And if they are running into these burdens and barriers, how are they overcoming them? And then where are their successes? And how do we scale up those successes for other states? Because from AAP's perspective, we do want to see this work, and we do want to see states implementing the vision of Family First, how it was originally intended. So I think that was our anchoring point. And so we thought about the landscape of who all we needed to be talking to. And we started with our pediatricians and asked them, what are you seeing? What are you hearing in your clinics and hospitals on the ground? And they shared not a whole lot. We feel like we're not really in the cone of communication of what's happening. And they gave us a good starting point of what questions that they were curious about from the health perspective. And then we started to pull together our research team and knew that we needed good chops, good research chops. And so went to our partners at Chapin Hall to help us design the rest of our project, which then was really the two phases of this 50 state survey and focus groups. And we can get into a bit more detail around that.
Talk about the focus groups for a second before we get into the findings. You kind of segmented it into a couple of different constituencies, so to speak, within child welfare, right?
Yeah. So the groups that we wanted to talk to were child welfare administrators. We wanted to talk to child welfare directors. We wanted to talk to leadership of QRTPs, and we wanted to talk to young people. Family First was drafted with and in partnership with people who have lived experience. So we wanted to make sure that that was a key pillar of anything that we were also doing to capture their perspectives. And, we have the great report from Think of Us that does that as well. But we were looking and ended up talking to a very specific group of young people who were old enough to consent to a focus group, but young enough to where they were actually in a congregate care setting that was converting to a QRTP.
Yeah, that's a tough needle to thread because it really hasn't been that long. I think that's why it's good. Like, obviously, I hope you guys do this 4 years from now, 2 year, whatever, because the anchoring of just capturing what was going on, like right afterwards, I think is important too.
Yeah, and right, this can be the first point that we look at for the research. So then if we were to do this again in however many years, then you can go back and say, well, these young people said this, and these young people, and now you have something to compare it to. So agree, it's still very early on, and we recognize that some of this is premature and that there is still a lot of remaining questions even after all of this
Yeah,
research.
but I'm glad you guys got this snapshot because there's some good and there's some concerning. So I guess maybe let's start with the good news, which is that, causally or otherwise to the Family First Act, the use of congregate care has declined in general since the onset of the law's limitations in 2021. Is that the right way to describe it?
Correct.
Okay. What were the numbers? So you guys kind of did an interesting thing here where it was like not the usual, like, let's get the AFCARS data for it. You kind of gave the states the chance to put it into kind of buckets, right?
Yeah, it was really hard to measure. So, I mean, the proportions of placement capacity in congregate care. So, what we had there were 62% or 28 states reported the decrease in the percentage of congregate care placement capacity. So, how many beds are they using? What is available? And then in turn reported a 64% increase. So, 29 states in kinship care placement. So, that was good, right? Because that's what we
Yeah.
wanted. We wanted more family-based placement, more family-based care. So that definitely goes on the good news roster.
Yeah, for sure. The good news roster. One thing that jumped out to me that was kind of interesting is, you had this overall kind of like big push down when you see it all at once, where like, the states, and then there were like these few states that were like already overusing and it like almost got worse than them. So like the big push was out of the 11 to 20% usage. Like we basically just like don't have states in that range anymore. They almost all went down to this range of using congregate care for like 0 to 10% of the youth. And then there were like, I couldn't tell from the numbers because like not every state replied, although you guys got a huge response rate in general. But it seemed like the states that were already kind of like super users got even more super usery of congregate care in the time, which I don't know what to make of that, honestly.
Yeah, yes, I'm right there with you. And it is interesting too to think about some of the news reports that we've seen over the past 3 years, with people saying like, oh, it's COVID, there's kids sleeping in offices, all this
Hmm.
stuff, there's not enough placements for them. I think we saw that as well. And another thing that was interesting that came out of particularly the focus groups was a lot of the QRTP leaders and child welfare administrators saying, well, we were already doing this. We were already like scaling back congregate care before Family First, or we were already making these changes. And so basically saying it was already set in motion and that Family First just codified it, which was kind of interesting.
Yeah, that's a great point. And then I think the thing that's also just like never been totally clear from state to state in that discussion that you described, which is like, well, we have these kids in offices or they're staying in hotels, is like, I don't think you could just make the leap that that's because there wasn't a bed available at a congregate care. Like in some cases, it seems like there are, and those programs won't take a kid. Some of these states do give a youth basically power to reject those placements. So they end up in, not saying it's a good thing that they're staying in an office, but it is partially by self-selection. They don't want to be in these residential care programs anymore. So it's way more complex than just like, oh, we just don't have the space.
It is. And it's hard when you have all these complex issues to also capture all of those
Yeah,
complexities in a report like this.
totally.
And that is one of the challenges walking away from it is already it's been a week since we've released and there's still so many questions coming at us about areas where we weren't able to focus because it is pretty, what we were looking at was implementation and how is implementation going. And so some of these issues too, hopefully in the future people can get to them or.
Before I was adopted, I felt like my life was already over.
My biggest fear was that I would age out and not know how to be sufficient on my own.
At a certain age, like they don't want you, you're troubled and stuff.
The clock is ticking for the more than 125,000 kids waiting to be adopted from foster care. Help the Dave Thomas Foundation for Adoption prevent them from aging out without a permanent family. Learn more at davethomasfoundation.org.
So let's talk about implementation and what you guys found there. And I have a few that I want to throw out to you, but before I get into my list after reading the report, anything you particularly want to emphasize, like as the chief architect and executor of this? Was there a thing that came back that really surprised you, good or bad, in terms of what implementation has looked like?
The IMD issue was
We're
not
gonna start there. We're gonna start with the most complex. Let's do it.
it didn't come up. I think that was I was shocked by that not really being like a barrier and burden that people reference and refer to. And that more so, I would say, like, probably the biggest one that stuck out to me was just how complex it is and what a challenge it is when you're trying to implement this and you don't have the staffing capacity, and not just numbers of staff, but staff who are trauma informed, well trained, want to stay in the work and can build those relationships that kids need to be able to heal and thrive. Like, that was just such a consistent burden that I think came up across all the groups we were speaking with.
Yeah, that's okay. So I think we got to explain to folks what you meant by IMD, and then I kind of want to get more thoughts from you on that. It's almost like I feel like it gets short shrift in all the conversations because it's just so mind-numbingly acronymy, but it is so important. So, okay, just on a general level, you can't use Medicaid to serve institutionalized people. There's a few exceptions to that. Some of them are aimed at younger people, like youth and young adults, like psych hospitals, hospital wings, and then this thing called PRTFs, which we don't need to get into here. Nothing in congregate care, like foster care, has that exception, except for those PRTFs. So what Keri's talking about is that, like, if you don't fit the IMD exception, if you don't have an exception to that, you're not really supposed to be spending Medicaid money to pay for the services or anything about what's going on in congregate care. So if I'm hearing you right, you're saying that it was a surprise to you that more directors didn't raise this as a problem. Like, however they are, they're doing what they're doing and they're still billing Medicaid. Is that what you mean? Or
No, I mean there were rumblings, like, again, leading up to October 2021 and months after, that this was a challenge for states navigating this issue, which then, thankfully we had some guidance come out from ACF, the Administration of Children and Families, that like offered, that letter that was saying, here's how it actually works, and this is actually a non-issue. And so I think I just wondered how states would answer about that. And what we found was that they didn't even really raise it. So I think that was interesting to me.
that is interesting. You guys list some questions that, like, in addition to the recommendations that you guys have, which we'll talk about later, you put some like questions that people should kind of have on their mind as they look at their state. And one of them was, given the complexities of Medicaid funding with, in particular, QRTPs, which is this one of those exceptions we talked about here, why did some states report not changing the size of their QRTPs to meet IMDb? And man, we are getting into acronym city so fast here. I feel bad. I try to avoid it, but I think just to simplify that, if you have less than 16 beds in whatever you're operating, you don't need to worry about this. Like, you can use Medicaid. So I think that was the point of the question, was like, you're saying, like, if you're an advocate in one of these states or a researcher, like, figure out why some people seem to be able to use the Medicaid pretty freely, but they're not downsizing, as like an open question.
Mm-hmm.
Yeah, I guess we'll see. That's the whole point. There's just so much more to find out, I think.
Yeah. I mean, and in each of the questions, you could almost do an entire, like, deep dive on just that question.
Okay, so let's go through a few things that jumped out to me here. Just welcome your thoughts on any of them. But so I kind of like read the whole thing and then kind of grouped them into different kind of themes. So one is usage of the exceptions. I think that's something where you guys unearthed information where nobody is like, how are people using these 4 exceptions to the rule that you can only draw down federal money for 2 weeks? So you want to lead people through kind of like generally what you found?
Yeah. So And you're talking about the settings where it's supervised independent living, sex trafficking, and then the maintenance of historical congregate care settings. So, and then pregnant parenting youth. So I think like with us, like one of the things that walking away from what we were able to find and then our recommendations is that there needs to be more data, more oversight of those, like what actually is happening, what does that look like on the ground, how is that playing out, especially the youth at risk of sex trafficking, because we know like all young people pretty much in foster care are at risk of sex trafficking. So I think one thing that stood out for us is, okay, what does that mean? Who's tracking that? Where's the oversight? And again, there's definitely going to need to be more data that we pull and look at in the future around those settings.
Yeah, I thought it was interesting. Like, so in the answers that came back, you had a lot of states say that as far as these 4 exceptions go, the one they're using the most is QRTP. In fact, in a lot of states, it's like almost 100%. In the average, I think it was 50%. And then you had these like smaller subsets of states that were saying the majority of the exceptions are these independent living or the sex trafficking placements. Now, I would draw like different conclusions from both of those. Like if the majority of the use is the supervised independent living, I would say that tells me you're mostly using congregate care for extended foster care because that's who that would be
Yeah.
for. But to your point, I think the other one is the one that should raise alarm bells because I don't put you on the spot to talk about it, but I mean, it's pretty well reported in Florida, for example, they have very rigorously moved towards kind of just basically making that case that like a lot or all of foster youth are at risk of sex trafficking, therefore we can use this for almost anybody. And that's not what I think the framers intended, so to speak, as far as this law went, right?
Yeah, going back to the original vision and intent of Family First, right?
Yeah. Yep. The question of actual change as it applies to QRTP was my second theme. So I think that it was really I kind of pulled 3 different comments that you guys got from different groups here that I think speaks to this. So you've got the child welfare administrators who kind of like a lot of them reflected on, the struggle to use these QRTPs, which again are supposed to be, for somebody in a pretty acute need, not for a long time necessarily, and then step them down back into like their family or to a
And
foster home
high
at least.
quality, really
High
looking
quality.
at quality. Yeah.
Right. Yeah. So they reflected on to you guys in the focus group, I guess, on the struggles to kind of actually have those as a specific treatment intervention. The QRTP leaders were more optimistic about their own ability to, provide a tailored need. And then there were young people who reported that the policy change did not match anything they perceived to be actually different. And I'm going to say that of all the things in this report, that is the one early on everybody needs to read and take heed of and think about as a red flag, to be honest, about this law, because there is a real risk that I think we don't give enough credit to in terms of like passing a law, being like, we did it, guys. There's a law now. And then just walking away. It's almost worse than not having it. And this is like, if this is true, and I know you guys did a good job of just getting like a small group together to do it, but if that's true, writ large, that's really bad because we're calling something and it's not.
Yeah, absolutely. And I think that was so misaligned. The young people and our what the QRTP leadership was saying and stood out to us as an area where we also need to be cognizant of how are we still supporting young people being in these spaces to help reform these settings and to help them to make the conversion to QRTPs or to keep making the progress towards high quality. So I think those are a couple of our recommendations is like, what are the standards for youth and family driven QRTP treatment plans? How are you really incorporating them in that process? And then also thinking about how can we set up these sort of advisory committees that are made up of youth and family who can really help these settings to make sure that the outcomes on the back end are matching what these QRTPs are set up to be, which is again, you're helping treat these young people, helping them heal, and it's high quality and time limited. And does that all match? So I think the other thing too that stood out there is it's just like mental health is such a consistent theme here, and the need for more support services on every level. I think as my hat of somebody who is personally impacted by the foster care system, but also a professional in this child welfare space, the system's traumatizing for everyone involved. It's traumatizing for young people, it's traumatizing for child welfare professionals, it's traumatizing for foster parents. And so that means that like we really do need therapeutic models, trauma-informed staff, and until that matches the people that are supposed to be implementing these changes, if that's misaligned, that is a huge red flag.
Last one on my list was related to that for sure, which is long stays. So you had administrators reporting the youth are being stuck in QRTPs. We're talking about QRTPs in this theme here, and kind of the dearth of community-based resources to kind of help them leave, which is something they're supposed to be doing. So not sure why they are licensed as a QRTP if they don't have that, but that seems to be a pervasive problem. And then, I think 11 states reported this average of like between 100 and 80. So like basically reported an average of a half year to a year that youth were staying, which I think was certainly not the anticipated outcome for placements in them, right?
Yeah, short term, right? Does that count as short term? I guess it depends who you ask. That was something we heard a lot too, was like it's really hard to have like the step down and to reintegrate the kids back into the community because of a lack of services, a lack of those customized plans. I think there's a lot of looming questions around aftercare and how is that being set up ahead of time and then throughout the child's treatment plan to really shift and make sure that it's meeting their needs and the family's needs so that they can successfully reintegrate into the community. I've heard of some models where, as a step down, they'll still offer the children like weekend placements or visits. And I wonder how that will play out long term. But right now, again, if you have a good model for this, email tips at Imprint.
Tips at imprintnews.org. So, but like she said, send it to us. No, I mean, maybe it's not our role, but somebody should, I think, probably be starting to get that concept together. It probably is the case that there are some people that do a really good job and have really good outcomes on short-term acute need stays. And there's probably somebody with a pretty good mousetrap for aftercare too, probably starting to kind of build that knowledge base.
We need to identify those, and they need to be, providing webinars and what they've learned, key takeaways, all of that.
So you guys list out a bunch of recommendations here, but in a kind of short elevator pitch, what would you say are the ones that you think, states and systems should be prioritizing off of the learning of your report here?
I think the biggest one, our headliner, is what I personally would say is key, is just this was such a large investment in time and money. And, really so many people believe that it can transform the child welfare system. And that still requires a bit more investment. And so there are additional resources that are needed to help states get up to par with things like their child welfare staffing, foster homes, therapeutic care models, and then the mental health pieces. Like we need more mental health services. That's nothing new in America, but especially if we want to see family first implemented as envisioned. And that was just such a key theme that we were hearing here. And so I think that resources and like technical assistance and funding is going to be critical moving forward.
I'll drop a link to the AAP's report in the show notes, along with, like I said, our guide and their old guide for implementation across the board. I wanted to take a minute towards the end here because we've been talking about Keri's kind of day job, full timer, but she is also the one of the many amazing hosts. And would you call yourselves hosts on Unbelievably Resilient? I don't want to say storytellers. Okay, so one of the chief storytellers on Unbelievably Resilient, which is, in my opinion, the best podcast in the child welfare space, and you should go and download it on Apple, Spotify, blah, blah, blah. New season is out. The first episode is up. It's a scorcher, amazing conversation about, I don't know, I don't want to distill it down to one thing, but I would say it's a great discussion on the right way to incorporate lived experience, the right way to use it. That's how other people should be, like advocacy groups, and should listen to it for that. But give these guys a preview. What else are you guys going to be talking about on season 3?
Yeah, well, our whole thing is shattering the stigmas and stereotypes about the foster care system based on our stories. And so this season, you're going to hear us talk about access to our foster care records and how either getting access or not getting access, shaped parts of our own identity. We are going to be bringing on some family members, biological family members, which will be an interesting take, adoptive family members. So really bringing in a different perspective, so it isn't just so siloed as, us, people who are in the system, and then a couple more deep dives into people's stories. All of us have such unique stories that are cut from the same cloth, but we really make up this diverse quilt of what it looks like to have been in the foster care system and life afterwards.
I am so glad that you guys are doing an episode on the records. I think I've kind of become obsessed with that idea of like, what is the right way that should be shared with young people? Because let's start from the premise that everybody should have access if they want it. But what got me going on it was I interviewed a guy actually from the UK who grew up in foster care there. It was literally just had his identity stolen. Like they didn't give his letters that his mom would send. They changed his name when he got adopted. His name is Lem Cisse. He's got a book called My Name is Why. That's a lot about this. But he did, Keri, appreciate it. He did a 1-act play where he sat on stage and another actress read his file that he had to sue the government to obtain. So he had it because he sued the government and got his records. And she read it, and it was like this really powerful presentation. But it just got me, that's what got me thinking. I'm sure you've thought about it for many more years than that. But I'm glad you guys are having that convo.
Oh
I think
my
that's
gosh,
really
I
amazing.
just got chills on that
Yeah,
front.
man.
And I remember I requested my records a few years ago, and you pay like $40 and you send it in the state and you wait several weeks and there's all this anticipation. And then what came back was an adoption certificate and a birth certificate that was the redone birth certificate. It's not even the original. And I know, right? If you guys could see John's face, his jaw's on the floor. Right. It's
But you
absurd.
can't because I don't have a good background like her, so I'm not allowing her to use my background. but wait, are you saying that no records? So like once you were adopted, it was like the other records don't exist for the purposes of
When you do a formal file request, they don't share any of that. And so then I didn't have, a sort of dissolved adoption, but when my adoptive mom passed away, then it was months after I did that record search through the state that I was going through her belongings and I found my original foster care file. Like it said,
wow.
Keri Hope Metzger crossed off, Keri Hope Schmidt crossed off, Keri Hope Richmond, which is my adoptive name. And in that file, it had all of these documents from the time I was born until the time I was adopted. And it had stuff on my bio parents, and we're talking police reports, doctor's reports, psych evaluations. And having it gave me so much more of a sense of compassion for myself and my story and also my family, that like, oh, it wasn't that they didn't love me and they just like chose, drugs and alcohol over me, or it was much more complex, and they have their own histories of trauma. And so I am like such an advocate. Everyone deserves access to their information, and it is abysmal the way that we try and keep that from people and then give them documents that are not the actual real documents. I could have literally taken $40 cash and flushed it down the toilet for what they sent me.
And I think I would start the discussion on the terms of like, we owe people who want to know about their past. We owe that to them. The conversation to me is more about like how the right way to do that is, because like you're in your 30s now, or barely.
No, not even.
No, not even.
Don't
30,
age me
right?
like that.
I'm sorry.
John.
You don't look it. I don't know. I feel like if, let's say that we coalesce around a policy that at whatever time you leave the system, you should go with any documents about your past that you would like. It seems like at 18 or 21, I mean, put yourself back in that age, like opening that file and reading it through solo, just like, here's the file, go read it at Dunkin' Donuts, like you would have been okay with that? Or would you have preferred somebody to kind of help you unpack it? Like, I think that's what we got to figure out.
Yeah, I think that's a great point. And especially now, like with 23andMe and all of the DNA testing that makes it so easy, people are finding out truths about themselves through these other avenues.
Yeah.
And it's like, would you rather that be the case or someone guiding them through the process where it's like trauma informed and they have a space to process it? And then there's new technology out in the child welfare space, like Connect Our Kids, which is compiling all of this information about kids.
Yeah.
And I know they have built out the Connections Matter Academy, which is this series of videos explaining trauma. And I think the idea behind that is that then when a young person becomes ready to have access to their information, they also have the background knowledge of like, okay, here's what trauma is, how it's impacted me, how, it gives them some baseline to understand all of the complexities that could be in their file or their records.
Yeah. And, I would just say, I think this is coming for the US. I mean, you see this happening in other places that have maybe over relied on adoption in the past, or certainly were way too secretive about it. Ireland, South Korea, these places are working towards atonement and reconciliation, and that includes information. I think we'll probably see that come here. Go check out Unbelievably Resilient. It's an amazing podcast, conversations like that. Keri Richmond, American Academy of Pediatrics, thank you for joining us on the Imprint Weekly Podcast.
Thank you, John.
Thanks to Keri Richmond, Manager of Child Welfare Policy for the American Academy of Pediatrics, for joining us today. And go listen to Unbelievably Resilient, which is a podcast that Keri is involved with. Truly great. Season 3 is out right now. The Imprint Weekly Podcast is a production of Fostering Media Connections, a California-based nonprofit that publishes the Imprint, Fostering Families Today, and operates the Youth Voices Rising program. This podcast is produced and mixed by Christine Onjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or give us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would support our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is easy. Just visit imprintnews.org/donate. You can follow the Imprint on Twitter and Facebook by searching the handle @theimprintnews and visit us on the web at imprintnews.org. And you can always reach us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.